Hello, my dear students. Hope you guys are all doing good. Hope you're all perfectly fine. So, in the previous session, we have completed discussing about the services which are provided by the government and the services which are provided to the government, which are exempted. So, that we have covered. So, we understood all the services which are, we understood various categories of services which are either provided by the government or the services, certain kinds of services which are provided to the government which are exempted from GST. When I say exempted from GST, on that GST will not be collected on that services. So that we have covered in our previous session. So now we will start discussing few more category of services which are exempted from GST. So now we will try to talk about healthcare services. So first we will try to complete healthcare services. So they say that healthcare, certain kinds of healthcare services are also exempted. See, as we all know, healthcare is one of the most important necessary requirement for any person. See, why a person will, what is the most important thing for a person? See, every person wants to be alive. Every person wants to live a healthy life. Every person wants his sickness, his illness to be cured. So healthcare is one of the most important thing required for citizens of any country. It is a most important requirement for anybody in this world. So generally, healthcare services are the responsibility of the government. Generally, healthcare services in developed countries, if you observe, healthcare services will be looked after by government. But in India, since being a developing country, our government is not able to provide enough of healthcare facilities for the people. So that's why we have private hospitals. We have private entities who are running these hospitals and healthcare centers, and through that, they are providing the treatment to the patients. Now, when the government is unable to provide, but if they come and say, hey, if the healthcare entities, if the healthcare services are getting provided, we will come and tax them. So that will be unfair. No, that will be more. Then the medical facilities will become costly for the common persons like you and me. So that's why what the government told is, okay, on healthcare services we will not collect GST. We will accept the GST on healthcare services. Why? Because healthcare is one of the most important thing for the people of the country, and the government should not make it costly by imposing the taxes. So now let us see which healthcare services are exempted. First, I will be addressing about entry number 74. So they say that services by way of healthcare services provided by a clinical establishment, an authorized medical practitioner or paramedics. Which services are exempted? Healthcare services, if they are provided either by a clinical establishment or an authorized medical practitioner or paramedics. If the healthcare services are provided by these people, then that services will be exempted. See, here we need to understand the meaning of various terms. We need to understand what activities will come under healthcare services. They are telling healthcare services will be exempted. Sir, but what will come under healthcare services? First, we need to understand it. Then they are telling not healthcare services provided by everybody. Healthcare services provided only by clinical establishment or authorized medical practitioner and paramedics. Healthcare services provided by these people only will become exempted. So we need to understand what are healthcare services, which activities will be included in the healthcare services, what is the meaning of clinical establishment, what is the meaning of authorized medical practitioner, who will come under paramedics definition, that we need to understand. So first let us try to have a understanding of that. First of all, meaning of healthcare services. Sir, what is the meaning of healthcare services? Healthcare services means any service by way of diagnosis, treatment or care for or care. When I say healthcare services, it includes three things. Number one, diagnosis. Diagnosis means what? Finding out the problem. For example, I went to the doctor, I went to the hospital and complained of a stomach pain. Now, first the doctor will perform some test on me to diagnose what is my problem, to find out what is my problem. So he wrote a scanning for me, he wrote a blood test for me, he wrote some other test for me. If I go and get that testing done, the doctor will find out what my problem is. This we call it as diagnosis. See, once my problem has been diagnosed, now what the doctor should do? He should do the treatment. For example, a patient came to the doctor, he complained of his stomach pain. The doctor asked the person to undergo various tests. Then he found out that there is some problem in his stomach. Now he performed the operation on that person. That is what treatment. Now, once the operation has been performed on the patient, will he just like that send him out? No. He will take care of that person also. He will give a room in the hospital. He will admit him. He will do regular visits. He will consult him. So, like this, When I say healthcare services, it includes three activities: diagnosis, finding the problem; number two, treatment or care. So activities by way of diagnosis, treatment or care for any illness. For any illness, for example, I became sick. I was suffering from some fever kind of thing. So if I am getting diagnosed, or if I am getting treated, or I am getting care for any illness or for any injury, if I have suffered some injury because of some accident, etc. So to diagnose, treatment or care, or any deformity. Deformity means sometimes people at the time of birth only they come up with improper limbs, somewhat broken nose. So these kind of things will happen when people come from birth only. For example, this kind of things will be very rare among some children. When they are born, at that point of time only they will have some problem with their limbs, face, or shape of the face, etc. So to diagnose, treat or care for that deformity. And also any abnormality, if there is any abnormality for you, if there is any diagnosis, treatment or care for that abnormality, or any or pregnancy in any recognized system of medicine in India. So when I say healthcare services, they include services by way of diagnosis, treatment or care. For what? For any illness, for any injury, deformity, abnormality or pregnancy in recognized system of medicine. See, if you are providing diagnosis, treatment or care only in recognized system of medicine, that only will come under healthcare services. Sir, which medical systems are recognized systems in which medical systems are recognized systems in India, sir? So if you come here to the second point, recognized systems of medicine in India. Sir, which kind of medicines are recognized? Which kind of medical practices are recognized medical practices? Let us see. Recognized systems of medicine in India are exempt under this entry. Following systems of medicines are the recognized systems. Sir, which medical systems are recognized, sir? Allopathy. Allopathy means nothing but our English medicine, Western medicine, whatever we are taking, that is allopathy. Or yoga. See, yoga has also been recognized as a system for it is also been recognized as a medical system to cure the diseases. Or naturopathy, Ayurveda, homeopathy, Siddha, Unani, any other system of medicine that may be recognized by the central government. For the time being now, only these systems are only recognized. What are they? Allopathy, yoga, naturopathy, Ayurveda, homeopathy, Siddha, Unani. Only these medical systems are recognized. In the future, if the government wants to recognize any additional system, any extra medical system, they can recognize it in the future. But for the time being now, we only have this 7 medical systems which are recognized in India. You have to remember it, guys. You should not forget it. So come on, repeat everybody. What are the recognized systems of medicine in India? Allopathy, yoga, naturopathy, Ayurveda, homeopathy, Siddha, Unani. Only these medical systems are recognized. For example, you got some problem, you went to some person who does a black magic. You are feeling sick, you went to some person who is doing black magic. He has done some puja, he has done some something, he has done something, he has played with your hair, something he has done, and he has cured your disease. Will that be called as healthcare services? No, that is not a recognized system of medicine. This black magic, all these things are not a recognized system of medicine. Only these systems are only recognized. What are they? Repeat everybody for one more time. See, I am intentionally making you repeat these many number of times so that you will remember, you will not forget it in the examination. Come on. So you have to repeat it. So only recognized systems of medicine are allopathy, yoga, naturopathy, Ayurveda, homeopathy, Siddha, Unani. Only these medical systems are recognized. So, if a person is providing any services by way of diagnosis, treatment, or care for any illness, for any injury, deformity, abnormality, or pregnancy in recognized systems of medicine, only by way of these systems of medicine, that only will come under healthcare services. Similarly, it includes also services by way of transportation of a patient to and from a clinical establishment. See, when I say healthcare services, they just doesn't involve only diagnosis, treatment, or care. Transportation of passengers, sorry, not passengers, transportation of patients to and from the hospital, that also will come under healthcare services. Take for example, one hospital is having an ambulance. So if any patient wants to get admitted, this ambulance will go pick that patient and bring him to the hospital. So this is a service by way of transportation of patients from and to the hospitals or clinical establishments. So that transportation of passengers also will come under healthcare services. However, healthcare services does not include hair transplantation or cosmetic or plastic surgery. See, hair transplantation, cosmetic surgery, plastic surgery, these are all not healthcare. This is what something you are doing for improving the beauty of a person. For example, if a person is there because of very extreme hard work and all, his hair has he has become bald. He has no hair on his head. So now he is going and visiting a hair transplantation center. Now they have transplanted the hair on his head. Now for hair transplantation, they will charge you some 2 lakh rupees, 3 lakh rupees, 5 lakh, depending upon the treatment. Hair transplantation will cost a lot. See, hair transplantation is not a necessary requirement. It is luxury. You are doing it for your beautification. So government told that if you go and get the hair transplant done, if you are doing the cosmetic surgery, for example, your nose is very small, you want to increase the size of your nose, you are undergoing a plastic surgery, your cheeks are very big, you want to get that jaw shape on your cheeks, you are undergoing a plastic surgery. These are beautification. These are not healthcare services. So healthcare services does not include hair transplantation, cosmetic or plastic surgery. If there is some doctor, if there is some medical practitioner, if he is doing a hair transplantation treatment for you, on that will GST come or will GST not come? GST will come. Why? Because only healthcare services will be exempted. Under healthcare services, hair transplantation, cosmetic or plastic surgery will not come. However, except when undertaken to restore or construct anatomy or functions of body affected due to congenital defects, development abnormalities, injury or trauma. That means if this particular except thing applies for cosmetic or plastic surgery. See, you're all perfectly fine person. Just for increasing your beautification, if you go and get the plastic surgery done or cosmetic surgery done, that is not healthcare service. But assume that you used to have proper nose. At one point of time, you met with an accident. Because of an accident, your nose things are all broken. To keep that nose in proper functioning condition, the doctor has to perform some plastic surgery on your nose. Now, here the plastic surgery will come under healthcare services. One simple logic, guys. If you are doing hair transplantation, cosmetic or plastic surgery for beautification, that is not a healthcare service. However, if these activities are performed to reconstruct some functioning of a body affected because of some congenital defects, because of some defects which you have faced, or because of your development abnormalities, sometimes during the child's development phase they incur some abnormalities. For that they might require to perform plastic surgery, then it will come under healthcare services. Or it could be because of some injury or trauma like accident, etc. You have some problem, to fix it plastic surgery has to be performed, then that will come under healthcare services. If you are doing hair transplant, cosmetic surgery or plastic surgery for increasing the beautification, that doesn't come under healthcare services. Clear, everybody? So why we understood healthcare services? Why? Because they are saying that healthcare services are exempted. So we understood what is healthcare service. As a part of that, we have also understood what are recognized systems of medicine in India. Now, healthcare services provided by everybody is not exempted. Healthcare services provided by everybody is not exempted. Healthcare services provided only by clinical establishment or an authorized medical practitioner or paramedics, they only will become exempted. What they are saying? So not all healthcare services provided by everybody will not be exempted. Healthcare services provided only by a clinical establishment, an authorized medical practitioner or paramedics, only when the healthcare services are provided by these three people, then only they will be exempted. Now we need to understand what is a clinical establishment, who is an authorized medical practitioner, who are coming under paramedics, that we need to understand. Very simple things, guys. First of all, we will try to understand what is a clinical establishment. When I say clinical establishment means a hospital. It could be a hospital, it could be a nursing home, it could be a clinic, it could be sanatorium or any other institution. By whatever name you call them. You might call it a hospital, you might call it as a nursing home, you might call it as a clinic, you might call it as a sanatorium or any other institution. Whatever you want to call it, you call it. That offers services or facilities requiring diagnosis, treatment or care for illness, injury, deformity, abnormality or pregnancy in any recognized system of medicine in India. So you call it as a hospital, you call it as nursing home, you call it as a diagnostic lab. See, even diagnostic lab is also a clinical establishment. Why diagnostic lab is also a clinical establishment? Why? Because it is providing services relating to diagnosis of a problem, of a illness, of an injury or pregnancy. Able to understand? So clinical establishment means any kind of entity, whatever you want to give it a name, give it, which is offering services relating to diagnosis, treatment, or care for illness, injury, deformity, abnormality, or pregnancy in any recognized system of medicine in India, or a place established as an independent entity or a part of an establishment to carry out diagnostic or investigative services of diseases. See, scientists will do in-depth research on virus. These kind of investigative studies they will conduct in some institute, in some research lab. So that also will come under clinical establishment only. So it includes the place where you are doing diagnosis, treatment, or care for disease. Or if at a place research is happening, investigation for the diseases is happening, research labs, medical research labs we call them, that also will come under clinical establishment. Thus, diagnostic or investigative services of diseases provided by pathological labs are not liable to GST. Even pathological labs, like for example, diagnostic centers will be there, no? Assume that there is a lab, no hospital, only lab is there. So in that lab they will conduct different kinds of tests, like scanning they will do x-rays, they will do blood test. So these kind of tests they will do. This lab, this could be a part of hospital, or sometimes these labs will not be part of a hospital, labs will be independent labs. So on some separate from the hospital, a separate lab has been established, some pathological lab has been established. Even that lab services also will come under clinical establishments only. So one thing I want you to remember here, when it comes to a diagnostic lab, whether it could form part of hospital or it could be a independent entity, in all the cases that pathological labs also will come under clinical establishments only. Then they use one more term here, healthcare services provided by authorized medical practitioner are also exempted. Sir, who is authorized medical practitioner? Let us see. Authorized medical practitioner means a medical practitioner registered with any of the councils of recognized system of medicines established. Like for example, allopathy medicine will have a council, homeopathy will have a council, similarly yoga also might have a council. So those medical professionals who are registered with any of the councils of a recognized system of medicine established, or they are recognized by law in India, and also includes a medical professional having requisite qualification to practice in any recognized system of medicine in India as per any law for the time being in force. So very simple. See, for example, if I wear a white coat, if I have a stethoscope on my neck, I will not be called as an authorized medical practitioner. Which person will be called as medical practitioner? Either he should be registered under any of the medical councils, or he should be recognized by the law, or he should be recognized, or he should have a requisite qualification. Like for example, in order to practice as a doctor, I need to have a qualification of MBBS. So those people who are registered with any of the medical councils, or who are recognized by the law as authorized medical practitioner, or who have a requisite qualification, those people only will come under authorized medical practitioners. Able to understand? Next one, paramedics. Sir, they are telling healthcare services provided by paramedics also are exempted. Sir, what do you mean by paramedics? When I say paramedics, these are not mainstream doctors. These are supporting doctors, you can say. Like for example, physiotherapist, and also there will be anesthesia specialist will be there. When operations are getting conducted, a person will come and give anesthesia. That person will be called as paramedics. So like this, supporting functionalities in a hospital, whoever they do, that people we call them as paramedics. So paramedics are trained healthcare professionals, for example, nursing staff, physiotherapist, technicians, lab assistants. These are all nothing but what? Supporting functions in an hospital. These people who are trained, so trained nurses, trained physiotherapists, trained lab assistants, these people we call them as paramedics. Services by them in a clinical establishment would be in the capacity of employee and provided in independent capacity, and will thus be considered as service by clinical establishment. See, one thing guys, what they are trying to say here is, let me try to put it this way, what they are trying to say here. These are related to future services which we are about to discuss, right? So what they are trying to mention here is, assume that there is a hospital. Now in the hospital, there will be some employees. Assume there is a nurse in this hospital, trained nurse is there. Now this nurse will provide services to the hospital. Nurse, for example, if a hospital is there, in that hospital they have one employee nurse. That means this nurse is working for the hospital as an employee. That services are anyhow exempted. That doesn't come under supply definition only. As if you go back to supply chapter, services provided by an employee to the employer in the course of employment, they will neither be considered as supply of goods nor supply of services. So if a hospital is there, let me put it this way, if the hospital is there, now there is a paramedic, a nurse is there. Now this nurse has become an employee of the hospital. So this nurse is providing services to the hospital as an employee. Will the service become taxable? No. First of all, this doesn't come under supply only. Why? Because these are services provided by employee to the employer. Assume that this trained nurse is there. She is not working for the hospital. She is independently providing nursing services to the patients. Directly she is providing services to the patients. Since she will come under paramedic, and if she is providing healthcare services like diagnosis, treatment or care to the patient, even independent services provided by these paramedics are also exempted. Why? Because they also will come under healthcare services. So one thing, if the paramedics are working with the hospital as an employee, anyhow they will not be supply. If the paramedics are an individual entity, separately they are providing the services to the patients, that also will be exempted. Why? Because healthcare services provided by paramedics are also exempted. So that's what they try to mention here. Services by them in a clinical establishment would be in the capacity of employee and not provided in independent capacity, will thus be considered as services by such clinical establishment only. Similar services in independent capacity are also exempted. See, if the paramedic is working as an employee with the hospital, that will be exempted. If the paramedic is separately, independently providing services directly to the patient, that also will be exempted. Clear, everybody? Able to understand? So with that, we have understood what they are trying to say here. So entry number 74, in that they say healthcare services which are provided by a clinical establishment or an authorized medical practitioner or paramedics, they will be exempted. So we understood what are healthcare services, what are recognized systems of medicine in India, what is the meaning of clinical establishment, what is the meaning of authorized medical practitioner, and who will come under paramedics definition we have covered. Now if you have a look at various services, see, when you go to hospital is a clinical establishment. See, in the hospital various services will be provided. Now let us see about the taxability of various services which will be provided. So various services provided by clinical establishments and their taxability. First one, rent of rooms provided to inpatients. So if the patient gets admitted, the hospital will also provide renting of the rooms. No, they will treat the patients. Along with treating the patients, they are also giving room on rent. See, this is what composite supply. This is a composite supply. Along with the treatment, they are also renting out the rooms. Composite supply. Which is the principal supply? What is the main supply? So if you go and stay in the hospital, is the main supply is staying in the taking accommodation, or is the main supply is, or the principal supply is treatment? Principal supply is a treatment. So even if you go and even if the hospital is providing services by way of renting of rooms to inpatients, that is a part of composite supply, where the principal supply is treatment only, healthcare services only. So that's why rent of rooms. So if the hospital is renting out the rooms and charging consideration for that, those services are also exempted. Those services are also exempted. Why? Because renting of services is ancillary. Renting of rooms is ancillary to the principal supply of treatment. So that's why even the renting of rooms to the patients is also exempted. For that they will charge consideration, even for that also exempted. But if you observe carefully, today hospitals are providing luxurious rooms. Today hospitals are providing luxurious rooms. See, some people will be able to afford this luxurious rooms. See, if they can afford the luxurious rooms, why can't they pay the GST? See, a common man will not avail that luxurious facilities provided by the hospital. So that's why what the government has told us, they have given extra provision they have given. So what they have mentioned here is, however, nothing in this entry shall apply to the services provided by a clinical establishment by providing room other than intensive care unit or critical care unit, intensive cardiac care unit, neonatal intensive care unit, having a room charges exceeding 5,000 rupees per day to a person receiving healthcare services are taxable. They are telling that healthcare services are exempted, but however, this exemption does not apply to those services where hospital is providing the room. If the hospital is there, if they are renting out the room, this hospital is there, in this hospital rooms are there, this hospital is renting out the room to the patient, and if the room rent charged is more than 5,000 rupees per day, more than 5,000 rupees, if they are charging the rent of the room, then that means they are providing luxurious service. If the patient is able to afford 5,000 rupees of rent per day, more than 5,000 of rupees, if he is ready to afford it, why can't he pay the GST? So that's why what the government told us here, exemption will not come, on that GST we will collect. So if the hospital is providing room, and if the consideration charged for that room is exceeding 5,000 rupees per day, on that services exemption will not come. On that renting of rooms, GST has to be collected by the hospital. However, this more than 5,000 rupees rent per day will not become applicable if the room rented was ICU or critical care unit or intensive cardiac care unit or neonatal intensive cardiac unit. See, these are all nothing but ICU. See, generally when the patients are kept in ICU, obviously the charge will be more than 5,000. So they have excluded this. If you stay in ICU, if you are admitted to ICU, CCU or ICCU or NNICU, there if you are paying per day more than 5,000 rupees, though they will be exempted. They will be exempted. Apart from ICU, apart from CCU, apart from this ICCU, apart from NNICU, if any normal general room you are taking for which you are paying a consideration of more than 5,000 rupees, then they told no exemption. Those services are taxable. Hospital will collect the GST and pay it to the government. Able to understand? Clear, guys? So what I am trying to say here is, as a general rule, rent of rooms provided to inpatients, whatever services which the hospital is providing by renting out the rooms to the patients, they are exempted. However, government thought nowadays hospitals are providing luxurious rooms to the patient. If the patient can afford the luxurious room, there is nothing wrong in collecting GST from him. So that's why what they have told is, if they are renting out any room for which if the hospital is charging you a consideration of more than 5,000 rupees per day, then the exemption doesn't apply. You have to pay GST on that. However, if the patient is admitted to ICU, CCU or intensive CCU and also neonatal ICU, these are all nothing but ICU units. If you are admitted to any of this ICU and if the rent charged is more than 5,000 rupees per day, still they are exempted. They are only talking about general rooms. General wards will be there. No, that rooms you are availing for which you are paying a consideration of more than 5,000 rupees, then there is no exemption from the GST. You have to pay, the hospital has to collect the GST from you and pay it to the government. Next one, services provided by senior doctors, consultants, technicians, exempted. See, for example, hospital, take for example, hospital is there. Okay, you are admitted to the hospital. Hospital is providing services to the patients. Now the services provided by hospital to the patients will be exempted. Now assume that there is a senior doctor, there is some doctor, senior doctor, consultant, technician, whoever it is. Now this doctor is providing services to the hospital. Doctor is providing services to the hospital. Hospital is providing services to the patients. Now what the government has given a relaxation is, even the services provided by the doctor to the hospital are also exempted. Why? Because ultimately you are treating patients only, no? Ultimately you are treating patients only. So that's why the services provided by hospital will be exempted. The services provided by doctors, paramedics or as consultants, those services provided by the doctor to the hospital also will be exempted. On that also GST will not come. Clear, everybody? Next one. Amount charged by hospitals from the patients. The entire amount charged by them from the patients, including the retention money or fee or payments made to the doctors, etc., is towards healthcare services provided by the hospitals, and it's completely exempted. So whatever money the hospital is charging, even including retention money also will be exempted. Sir, what do you mean by retention money? Take for example, you are admitted to a hospital. Hospital is charging you 50,000 rupees of charge. Along with that, they say some retention money. When they say retention money, they will say that, sir, for taking you from stairs, from upstairs to downstairs, we will charge 500 rupees. Every day lab assistant is coming and doing some testing for you. For that, for him we have to pay 1,000 rupees. So like this, every day someone is coming and checking the BP for you. For that person, the charge is 500. So these kind of other charges we call them as retention money. Even this retention money is also exempted. Why? Because this is also what? Healthcare services. whatever main expense you are bearing for staying in the hospital, the treatment, all that things also will be exempted. Apart from that, these kind of retention money for taking you upstairs and downstairs, for checking your test regularly, for collecting your blood samples regularly, for checking your BP regularly, for these services also, for these services, whatever money the hospital is charging, that we generally call it as retention money. On that retention money also GST will be exempted. Why? Because retention money is also considered as healthcare services only. Now, food supply to the patients. Now, if you observe this so-called big hospitals, super specialty hospitals, when they treat some patient, that patient should be given only certain kind of food. They can't feed any kind of food to the patient. Depending upon the illness, if they treat some patient, they will give one specific kind of food with certain combinations. They will offer a specific kind of food. Now, whatever food which was offered to the inpatient, whoever has been treated, to that patient, if the hospital is serving the food which is required for his wellness, now that is also a healthcare service. That food charged for price money charged for providing food to the inpatients is also exempted. What if food is provided to visitors? What if food is provided to the attendants of the patients? Those will be taxable. That is not healthcare service. Food provided only to the patient whoever has been admitted, the patient whoever has undergone the treatment. In order for his wellness, hospital will provide some food to him with mix of ingredients, with mix of nutrients. So that food provided to the inpatient is exempted. Now, a hospital is running a canteen where visitors, attendants of the patients, they can also go and have the food there. That will be taxable. On that GST will come. So that's what they say here. Food supplied to the patients. Healthcare services provided by the clinical establishments will include food supplied to the patients. But such food may be prepared by the canteens run by the hospital or may be outsourced by the hospitals from outdoor caterers. See, if the hospital is providing food to the patient, so there is a patient admitted in this hospital. So now to this patient, the food has to be provided. Now, how this food can be provided is either hospital can have their own canteen. In their hospital only, they have one canteen. So in that canteen, they will prepare the food and give the food to the patient. One more thing, what hospital can do is there is some catering service provider. They have outsourced that. So a caterer is there. He provides the food to the hospital and hospital will provide the food to the patient. Able to understand? So when hospital is giving the food to the patient, either that food could have been prepared in the canteen of the hospital only, or hospital could have procured the food from a caterer and then provided to the patient. Now what they are saying here is, when outsourced, there is no ambiguity that suppliers shall charge tax as applicable and hospital will get no input tax credit. So what is the meaning here is, if the food is provided to the inpatient and if it is prepared in the canteen only, then there is no GST on that. Then there is no GST. Hospital will not collect any GST. Why? Because that is also a healthcare service. Similarly, if the caterer, if they have procured the food from the caterer and then provided to the patient, see, now the food provided by hospital to the patient will be exempted, but the caterer is providing the food to the hospital, no, these services will become taxable. On that GST will come. On that GST will come. Not on food provided to the patient by the hospital, but caterer will provide, this catering service provider, he will provide the food to the hospital, no, on that GST will come. See, what they are trying to say here is, so let me try to put it this way. So assume that here we have a hospital. Now in this hospital, there is one room. This is the room in which a patient is sleeping. Okay, he's sleeping on the bed. Now for this patient, food has to be provided. Now inside this hospital, assume that there is a canteen area. Inside there is a canteen. Now the hospital management only will prepare the food and give the food to the patient. So hospital management will prepare the food and give that food to the patient. For that, they will charge some consideration for the food. Will this service be taxable? No, this service will be exempted. Why? Because providing food to the inpatient is also a healthcare service. Let us take another example. So assume once again hospital is there. Now in this hospital also, once again in this room, a patient is lying on the bed. Okay, so here a patient is lying. So now for this person, a food has to be given. Now hospital doesn't have their own canteen. Now what the hospital will do is, there is some catering service provider is there. So from that catering service provider, they will get the food. Who will get the food? Hospital will get the food. And this hospital, whatever food they have got from the caterer, that food will be served to patient. For that, they will charge the consideration. Now here also, the food supplied by hospital to the patient, this is exempted. This is exempted. Why? Because this is also what? Healthcare service. But the caterer is providing food to the hospital, no? See, when the caterer, assume that the caterer has supplied the food to the hospital at 1000 rupees. Now, on this 1000 rupees of food, which is supplied by the caterer to the hospital, on that GST will come. On that GST will come. So, caterer on that, assume the food GST rate is 5%. So, on the food which has been supplied by this catering service provider to the hospital, on that, along with the consideration, he will also collect GST. Assume 5%. He will also collect 5 rupees of GST and then pay to the government. 1005 rupees he will pay to the 1005 rupees he will collect, 5 rupees he will go and pay to the government. Able to understand? Not 5, I think 50. So 50 rupees he will collect and pay to the government. Able to understand? See, one thing, ultimately the food supplied by hospital to the patient is exempted. Whether it is supplied within the hospital canteen or it is procured from the caterer, the food supplied by hospital to the inpatient is always exempted. But in case if the hospital is procuring the food from outside, now the services provided by the catering service company or that outward food supplier to the hospital, on that GST will come. On that there is no exemption, on that GST will come. Hospital will pay GST. Hospital will pay GST to caterer, but on that they will not get input tax credit. Now take for example, the caterer has charged 1000 rupees for the food. On that GST has collected 1050 rupees, hospital will pay. Now for this 1050 rupees, 1000 they have paid for price of the food, 50 rupees they have paid for GST. Can the hospital claim this GST input tax credit? No, hospital can't claim this input tax credit. Why hospital can't claim that for input tax credit? Why? Because, which we will see in the input tax credit chapter, the act says that whatever inputs you have procured for making exempt supplies, on that they will not allow you input tax credit. Simple. This is what blocked credit we say, which we'll anyhow discuss in the input tax credit chapter. So what the government has told is, if certain business entity or if some registered person is procuring inputs, when I say inputs, that could be input goods, input services, input capital goods, whatever it is. So if a business person is procuring inputs on which he has paid GST, and if he is using that inputs for making exempt supplies which doesn't attract any GST, then what the government has told us, we will not allow you this input tax credit. Why? Because you are not using this inputs for making taxable supply, you are using this inputs for making exempt supply. On exempt supply, you are not required to pay any GST. Then why the government will allow you input tax credit? So that's what the simple logic of the government. If you are using inputs for making exempt supply, on exempt supply you don't have any obligation to pay the tax to the government. Since you don't have any obligation to pay the tax to the government, we will also not allow you input tax credit. So that's what will happen here also. So the services provided by the caterer to the hospital, that will be taxable. Hospital will pay GST on that, but they will not be able to they will not be able to get input tax credit of the same. Clear? Next one. Food supplied to the inpatients as advised by the doctors or nutritionist is a part of composite supply of healthcare. So that's why it is not separately taxable. So if you are providing food, that is along with the treatment you are doing, that is a composite supply. Principal supply is healthcare. So that's why it will be exempted. Entire value will be exempted. Other supplies of food by a hospital to the patients who are not admitted or their attendants or the visitors, that will become what? Taxable. If they are providing food to other than admitted patients or the visitors or the attendants of the patients, that will be taxable. Next one. Services other than healthcare services in clinical establishment premises. See, apart from healthcare services, if any extra services are provided by clinical establishment, they will become taxable. Like what? Supply of services other than healthcare services, such as renting of shops. In the hospital compound, there are shops. They have given that shop on rent. That is a other than healthcare service. On that GST will come. Auditoriums in the premises of clinical establishment. In one clinical establishment, there is an auditorium. That auditorium has been given on rent for a seminar. That on that GST will come. Or display of advertisements, etc. will be subject to GST. In one hospital, they have given some space for advertisement to some pharmaceutical company. So that is not healthcare service. on these other than healthcare services, these are not exempted. These will become taxable. Able to understand? So only healthcare services provided by clinical establishment, authorized medical practitioner, or this paramedics, only healthcare services will be exempted. Apart from that, if they are doing any other services other than healthcare services, they will become equally taxable. There is no exemption for them. Understood? Now, see, one more kind of service is there which is exempted, which is services provided by way of, if you come here, if you read this 74B, services provided by way of transportation of a patient in an ambulance other than those specified in A above. Now, what is this? What is this is, see if a hospital is providing ambulance service, that is exempted. If a hospital is in A point, they say that healthcare services include transportation of passengers also. But point number A says healthcare services provided by clinical establishments are only exempted. Take for example, an hospital is there. That hospital is providing ambulance service. So transportation of passengers is a healthcare service provided by a hospital, that is exempted. Now assume that I am an individual driver. I have a bus, I have one van I have. Now using this van, I want to provide transportation of passengers to and from the hospital. I have one small bus. I have converted that into ambulance. I am not a hospital. I am not a doctor. I am not a paramedic. I am just some random person. I have some vehicle, converted that into an ambulance. So I am providing the transportation of passengers on my own capacity. I am not a clinical establishment. I am not a authorized medical practitioner. I am not a paramedic. I am just one normal person. I have bought one vehicle and I am providing the services of transportation of passengers. Now the government has told even my services are also exempted. Even my services are also exempted. If I am other than clinical establishment, if I am not an authorized medical practitioner, if I am not a paramedic, but still if I am providing services by way of transportation of transportation of patients to and from the hospital, those services are also exempted. So that's what they say here. Services provided by way of transportation of a patient in an ambulance by other than those specified in A above. See, if a clinical establishment does it, anyhow it is exempted under A point only. But if I am not a clinical establishment, I am doing it on my own. I am doing transportation of passengers on my own. I am not a clinical establishment. Even my services also will be exempted. If they are provided by hospitals, anyhow they are exempted. If I am not any of the medical practitioner, if I am not a clinical establishment, I am doing it in my own capacity. In that case also, my service of transportation of patients also will be exempted. Clear? So that is what this B point. That is what this B point. So then one more entry number 46. Services by way of veterinary clinic in relation to health care of animals and birds are also exempt. Obviously, no. See, animals are also living beings only. They also will have problems. They also will suffer with some injury. They also suffer from accidents. A veterinary doctor will provide the treatment to the pets. On that also, you should not charge a GST. Now, Red Cross people will complain. No, so that is not the case actually. Why? Because even healthcare services for pets is also equally important. For animals and birds are also equally important. So that's why what the government has told us, if a veterinary doctor or a veterinary clinic, if they are providing healthcare services to animals, birds, etc., on that also GST will not come. On that also GST is exempted. So next time when you take your pet to the doctor, when you take your pet to the veterinary doctor, so he will not ask you GST. Why he will not ask you GST is why? Because even the services of veterinary clinic for the health care of animals and birds is also exempted. Clear everybody? See, but if you have a pet, if you have a cat or a dog, see, I have generally cat. So I have a pet. I love animals, not on the plate. I also love animals to be living along with me. So I have my cats. Assume that there will be pet clinics will be there. If I take my cat for haircut, if I take my dog for haircut, will that services be taxable? Yes. That is not healthcare. That is beautification for the animals. That is what? Beautification for the animals. So if the veterinary clinic is providing health care for animals, that is exempted. If I take my dog for bathing, if I take my cat for bathing, if I take my animals, if I take my pets for hair care or nails, these kind of things, these kind of services also they will provide. So that services will become taxable. Able to understand everybody? So this is what entry number 46 is about. So with this we are done with healthcare services. But we have one small circular clarifying one issue. Let us read that circular also. So there came a issue before the government. What was that issue is clarification regarding applicability of GST on services in the form of ART versus IVF, ART or IVF services. See, these are related to fertility. These are the techniques which are used by the hospitals for to make the people get fertile. That means they help them with the pregnancy of the ladies. So a doubt came before the department, sir, whether this services of IVF, ART, which will help the people to become pregnant, so whether these services also will become exempted. Yes, they are exempted. Why? Because they are also relating to diagnosis, treatment, or care of pregnancy is also there. When we read the healthcare services definition, we have seen that it includes activities by way of diagnosis, treatment, or care of pregnancy also. So that's why services provided by way of ART or IVF, which will help the ladies to get pregnant, even those services also will be covered under healthcare services. Those are also exempted from GST. So that's what they try to mention here. The issue which arose for consideration was whether GST is applicable on services by way of assisted reproductive technology, procedures such as IVF, healthcare services provided by clinical establishment and authorized medical practitioner or paramedics are exempt from entry number 74. As per the definition of healthcare services, it means any service by way of diagnosis or treatment or care for illness, injury, deformity, abnormality, or pregnancy also. So they have told the definition of healthcare services. Then they told since the abnormality, disease, or ailment of infertility is treated using ART procedure such as IVF, it is clarified that services by way of IVF are also covered under definition of healthcare services and hence they are also exempted. Able to understand everybody? So the services provided by the clinical establishments which are helping the ladies to get the pregnant by way of ART or IVF, these kind of services, they are also coming under healthcare services. They also will be exempted. Clear everybody? So this is what regarding healthcare services. So with this we are done with healthcare services category also. Just give a quick reading of all the things whatever we have discussed regarding healthcare services. You can definitely find one small question on this healthcare services. They will definitely ask you some question on this healthcare services. So please give a quick reading of whatever I have explained you till now. Come on, do it. Make it fast. Okay, now we have one question to solve regarding this healthcare services. So let us try to solve that question. Okay. Yes. So question number 4. See in this question number 4, they are talking about one clinical establishment which is providing various kinds of services. Now we are required to comment whether these below mentioned services are taxable or they are exempted. So Good Health Medical Center, there is a clinical establishment. It is going to offer those kind of, there are various kinds of services which this clinical establishment is providing. We are required to comment whether these services are exempted or they are taxed. First one, Reiki healing treatments. They're providing what? Reiki healing treatments. See, Reiki healing is a kind of therapy, is a kind of system of medicine. But as I have told, only recognized systems of healthcare services, only in recognized system of medicine are only exempted. And we know recognized systems of medicine include yoga, allopathy. So allopathy, yoga, naturopathy, Ayurveda, homeopathy, Siddha, Unani. Only these medicines, these systems of medicine are only recognized. Reiki healing is not a recognized system of medicine. It is not recognized in India. So the whatever services which this medical establishment is providing by way of this Reiki healing treatments, that is not a recognized system of medicine. These are not exempted. These are taxable. These services are what? Taxable. These services will not be exempted. See, you might get a doubt, sir, what is Reiki healing? Let me show you some images. What is Reiki healing? So let me show that for you. Okay, so let me show what is Reiki healing. So if you search it, you will get to know they do some kind of magic kind of things. See here. See, I'm not criticizing anything else, just I'm telling. So it is what they will try to do here is they will try to speak with your soul, some kind of gestures. They relieve the stress, they relieve anxiety. So these kind of services we call them as Reiki therapy. So this Reiki healing services are not a recognized system of services in India, recognized system of medicine in India. So if this medical institute is providing Reiki healing services, that is not a recognized system. Those are not exempted. Those are taxable. Next one, plastic surgery. One such surgery was conducted to repair cleft lip of a newborn baby. See, when I say newborn baby, it is a what do they say? Congenital disability. Something we have told no. So when I say healthcare services, generally that does not include hair transplant, cosmetic or plastic surgery. But if they are done to remove some disability, to promote the functioning of some organ, then it will be considered as healthcare services only. So generally plastic surgeries are taxable. But however, since one such a surgery was conducted to repair cleft lip of a newborn baby, this is because of some deformity at the time of birth of a child. So if you do plastic surgery to adjust it, then that is forming part of healthcare services only, not a beautification service. So that will be exempted. So that's what they say here. Healthcare services does not include cosmetic or plastic surgery except when undertaken to restore or to reconstruct anatomy or functions of a body affected due to congenital defects, development abnormalities, injury or trauma. Therefore, plastic surgeries will not be entitled to said exemption and thus GST would be payable. However, plastic surgery conducted to repair a cleft lip will be eligible for exemption as it reconstructs anatomy or functions of a body affected due to congenital defects. So then it will become exempted. Next one, air ambulance services to transport critically ill patients from distant locations to the medical center. See, transportation of patients to and from the hospital, that is also healthcare service. They are telling air ambulance service, not a problem. So if you are transporting the patients, if you are using whatever may be the mode of transportation, you might be transporting it through air, you might be transporting it through road, you might be transporting it through water, whatever it is, doesn't matter. Any services which are provided in relation to transportation of passengers, transportation of patients, they will be exempted. That could be by air also, but transportation of patients is a healthcare service, that is exempted. GST will not come. So exempted. Healthcare services include services by way of transportation of patients to and from a clinical establishment. Thus, air ambulance services to transport critically ill patients to good health medical center would also be eligible for exemption. See, when I say transportation of passengers, transportation of patients, it is exempted. That transportation can happen through water, air, road, whatever it is, doesn't matter. Transportation of patients also is a healthcare service and it is exempted. Next one, palliative care for terminally ill patients. See, when I say palliative care, it is also a forming part of allopathy only. It is also forming part of that English medicine only. See, what do you mean by palliative care? Means those people who are terminally ill, those people who have very big diseases like cancer, etc. They require medication along with moral support also. So palliative therapy means where where medical professionals will come and give you medication. Along with that, they will also give you some mental support. It is forming part of allopathy only. It is also a technique of English medicine only. So this clinical establishment is providing palliative care for terminally ill patients. On request, such care is also provided to patients at their homes. Then palliative care is given to improve the quality of life of patients who have a serious or life-threatening disease, but the goal of such care is not to cure the disease. See, when I say palliative care, that is not only to cure the disease. As I have told, they will also give you moral support also. But this palliative care will also come under broad category of allopathy only. Why? Because they give you medication. Along with that, they will give you moral support also. See, to fight this very serious diseases, only medication alone will not be enough. You need that strong will also to overcome that medical issues. So that kind of treatment they will provide in palliative care. That is also forming part of allopathy only. So the services which are provided by way of this palliative care to the terminally ill patients, that is also a healthcare service in recognized system of medicine. Those are also exempted. See, they add extra information here. On request, they are not coming to the hospital. The medical practitioner is going to the patient's home and providing the service. Still exempted only. When I say healthcare services, they might be provided at the hospital, they might be provided at the home, doesn't matter. If a healthcare services are provided by any clinical establishment, either at their premises or at the patient's premises, by a authorized medical practitioner at their premises or at the patient's premises, or if they are providing it provided by paramedics at their premises or patient's premises, doesn't matter. So providing healthcare services by a clinical establishment or authorized medical practitioner or paramedics is exempted. So here, whether this palliative care is provided at the patient's premises, at the establishment's premises, doesn't matter, that service will be exempted. So palliative care is also forming part of allopathy medicine only. So that's why it is a recognized system of medicine. So that's what they say here. Healthcare services means any services by way of diagnosis, treatment, or care for illness, injury, deformity, abnormality, or pregnancy in any recognized system of medicine. As we know, it is immaterial whether such a service is provided at the clinical establishment or at the home of the patient or at any other place. Thus, palliative care for terminally ill patients is exempted. It will not be taxable. And one more thing, alternative medical treatments by way of yoga. Yoga is also a recognized system of medicine. So if you are providing medical treatment by way of yoga, that is also a healthcare service, that also will be exempted. So that's what they say here. Since yoga is a recognized system of medicine, in terms of Section 2 Clause H of Clinical Establishments Act 2010, the same would also be eligible for exemption under the said notification. They say one more thing here. Good Health Medical Center also operates a cord blood bank which provides services in relation to preservation of stem cells. See, nothing but when the baby is born, that baby will be attached to the mother by way of that umbilical cord. Now, some service providers are there who will cut that cord and preserve it, and they will store it. Why? Because this baby, if they when they grow up, if they face any serious problems, they can use that cord, that umbilical cord they can use, and they can cure the illness of the babies. So this is increasing nowadays. Preservation of cord blood cells. So nothing but that umbilical cord will be preserved by professionals. They will freeze it. They will try to properly store it. So that services we call it as providing services in relation to preservation of stem cells. See, earlier exemption used to be there for this service also. Earlier there used to be exemption, but recently as an amendment they have removed this exemption. Earlier, like as you could see at the end of the chapter, I have given a few services which are recently withdrawn. Why I have given recently withdrawn assumptions? Why? Because from the recently withdrawn assumptions, there is a high chance of asking the question. So that's why what I have given is at the end of the chapter, those services which are those exemptions which are recently withdrawn, I have given it here. So that's why I have strike it off because they are no longer relevant. But still from this they can ask you questions. So earlier what used to happen is, let me show you where is that. Yeah, here if you read it. Earlier, what used to be happening is services provided by cord blood banks by way of preservation of that stem cells or umbilical cord or any other service in relation to such preservation. This used to be exempted. Services provided by cord blood banks used to be exempted, but that exemption is withdrawn. Since the exemption is withdrawn now even these services also will be taxable. They will not be exempted. So this is not exempted now. This is taxable. Earlier, there used to be exemption, but they have withdrawn this exemption. So because of that, the services will become taxable now. So Good Health Medical Center also operates a cord blood bank, which provides services in relation to preservation of that stem cells or umbilical cord. Even that services are also taxable. Earlier there used to be exemption, but now they become taxable. And Good Health Medical Center is of the view that since it is a clinical establishment, all the services provided by it as well as services provided to it are also exempted. Do you agree? See what exemptions I have told. Services provided by services provided by healthcare units are only exempted. Outward services of clinical establishments are exempted. I never said inward supplies of hospitals are also exempted. Did I say it? No. Only outward supplies of hospitals will be exempted, not the services supplied to the hospitals. I never said that. If I am providing some services to the hospital, my services are not exempted. Services provided by the hospital are exempted. Able to understand? So that's what they say here. It is important to note that entry number 74 of the exemption notification grants exemption only to healthcare services provided by a clinical establishment. not to services provided to a clinical establishment. Therefore, Good Health Medical Center's contention that since it is a clinical establishment, all the services provided to it are also exempt is not correct in law. Services provided to hospitals will be exempted only, services provided to hospital will be taxable, only services provided by hospitals are exempted. Outward services are exempted, not inward services. Able to understand? So these are all various exemptions for a healthcare services. Understood? So we have understood one more category of exemptions. So remaining exemptions, we'll try to see it in our next class. That's all for now. See you again in the next class. Bye everybody. Take care.